my name is Kelsey Dillenberg and I'm with the University of Texas at El Paso in a pediatric nurse practitioner program. I will be performing a head-to-toe assessment on a volunteer KE today. Prior to entering the examination room, I had the patient empty her bladder, as well as we did vital signs, which were all normal, none of them were abnormal. And we also took her height and weight. And we did a Snellen, a visual acuity test outside, which was 20/20 in the right eye and 20/15 in the left eye, as well as a near vision Rosenbaum chart. Throughout the entire assessment, I will be assessing her mental status and proprioception to this exam, and we will begin. Hi, my name is Kelsey. I'll be your nurse practitioner today. Are you feeling any pain?
No.
Good. 0 out of 10?
0.
Okay, good. Can you tell me your name?
Carrie?
Can you tell me your date of birth?
Yes, April 18th, 1964.
Good. Do you know where we're at today?
Yes.
Do you know what today's date is?
Today is April the 9th.
Okay, good. All right, patient is appropriate to the exam, verbalized appropriately through her mental status examination. I'll now begin examining the scalp and the head and face. I'm going to be looking for any abnormal lesions or masses. I'm going to look at hair distribution. I don't notice any alopecia or hair loss. Her hair is a nice medium brown color with blonde highlights. Any tenderness on your head?
No.
Good. Her scalp is nice and symmetric. No problems there. I'll also look at her face, which is symmetrical. We'll palpate all of the facial bones. Any tenderness?
No.
Good. I'll palpate her frontal and maxillary sinuses. Any tenderness?
No.
No?
No.
Good. All that was intact. I'll have you smile. Can you stick out your tongue? Can you puff out your cheeks? Can you wrinkle your forehead? And squeeze your eyes tightly shut. Good. This was testing for her cranial nerves 5 and 7, which are intact. Now move on to the eye examination. I'm going to look at the patient's eyes. They're nice and symmetrical in shape. The iris is a nice blue-green color. Her pupils are small and black. Her sclera is nice and white, and her vessels are small. There's no hemorrhaging noted. Her conjunctiva is pink. There's no discharge or any discoloration noted. Her eyebrows are a nice shape and full. Her eyelashes are intact with no abnormalities there. I'm going to palpate her eyelids. There's no swelling or edema noted on her eyelids. I'm going to palpate her lacrimal apparatus. Good. No tenderness there?
No.
Good. So no tenderness, no discharge noted. Her eyes look good. We're going to do a couple eye examinations to test her acuity as well as her visual fields. So if you'll just pick a spot on the wall straight ahead and watch.
Okay.
And just keep watching it. Good. Good. If you'll look at the end of my nose. Good. Keep looking. Good. Patient is positive for equal and bilateral reaction to light on both eyes bilaterally. She's also, can you look at my finger? Good. Can you look at the wall and back at my finger? Good. Positive for accommodation. Okay. If you'll look at the tip of my nose, just straight ahead. Good. Keep looking there. Good. The cover and uncover test, I was looking for lateral movement of the eye that I uncover. That would test for a positive strabismus test, which was negative. So she has no abnormalities there. I will now move on to the ophthalmic exam. You want to turn it on and make sure it's on 0. When I'm looking in the right eye, I'm going to be using my right hand. When I'm looking in the left eye, I'll be using my left hand. So just look straight ahead for me. Good. The red eye reflex is positive. It's nice red and yellow color. The vessels were followed to the optic disc, which was nice and round. No problems. I didn't see any lesions or any abnormal colors. The fundus was identified as a nice beige color, so no abnormalities there. I will now move on to the ear examination. We're going to examine both ears. They're nice and symmetrical, even with the eyes. They're nice and firm, have a good recoil, no abnormal colors, they're nice and pink. Any tenderness on your ears?
No.
Good. I'm going to be just inspecting the outside. Everything looks nice. I'm going to also test for her cranial nerve 8. I will be whispering a word from behind you. If you'll just tell me the word, say out loud what I whisper.
Apple.
Good. Great. Good. Cranial nerve 8 is intact. I'll now move on to the otoscope examination. You want it on an adult, make sure you pull up and back. Good. Good. I can see all the ear canals. The cerumen earwax is not much, a couple pieces here and there that were light yellow and dry. There's no drainage or any extra fluid noted in the ear, no inflammation or bleeding. Anything abnormal was not observed in the ear. I will now test using the Renee Weber test. This also tests for cranial nerve 8. This patient does have a history of congenital hearing loss, so that will be found on this examination. Normal findings would be slightly different than this one. So I'm going to have you tell me if you can hear both ears bilaterally the same when I put this on your head. Can you hear that?
No.
No? Okay. Can you hear that?
Yes.
And both the same or
Both.
more?
Both
Both
the
of them?
same.
Okay.
Mhm.
We'll move on to the Renee test. Tell me when you can hear it.
I can hear.
Tell me when it goes away.
Goes away.
Can you hear it?
Yes.
Did it go away?
Yes.
Okay. We'll do the same one on the other side. Just tell me when the sound goes away.
It's gone.
You never heard it? Okay. So this patient, there is more bone conduction lasts longer than the air conduction. When in a normal finding with a patient with no history of hearing loss, their air conduction should be about twice as long as their bone conduction. So this patient has conductive bone hearing loss. The differences in a pediatric examination is you're going to pull the auricle down. The eustachian tube and the auditory canal are actually smaller and they're more flat, which is why pediatric patients are more prone to fluid buildup and ear infections. When you're examining the ears, you also want to look for any skin tags. In utero, the baby's ears and kidneys are actually forming at the same time. So if you find anything abnormal with the ears, that could be indicative of something wrong with the kidneys. Okay, I will now move on to the nose examination. The patient's nose is nice and symmetrical. It's straight. There's no deviation noted. Can you sniff for me? Good. Sniff. Good. Both sides are patent bilaterally. I'm now going to examine in the nose. Good. This one. Good. Small amount of hair, no polyps or drainage or anything noted. Any tenderness in your nose? No. No inflammation, redness, erythema, anything like that noted. Everything looks great. I'm now going to test cranial nerve 1. If you'll close your eyes and tell me what you smell.
Alcohol.
Good. So cranial nerve 1 is intact. For the nose of a pediatric patient, you want to make sure that you're assessing the patency. Infants are obligate nose breathers, And so you want to make sure each nasal passage is working appropriately so they can breathe. We're moving on to the mouth. The patient's lips are nice and pink, no lesions, no ulcers noted, they're moist. Can you open your mouth for me? Good. Her tongue is nice and pink as well. Her teeth, good, are nice and symmetrical. They are a slight yellow discoloration. The patient does have a history of taking tetracycline as a child, which turned her teeth this color. Can you open your mouth for me? The buccal mucosa is nice and pink and moist. I note about 28 adult teeth. No crowns or abnormalities with her teeth. Can you stick out your tongue? Say ah. Good. The soft palate rises just as it should, with the gag reflex intact. This is cranial nerve 9 and 10 is intact. Can you push my finger away with your tongue? Good. This side? Good. Cranial nerve 12 is also intact as well. I'll move on to assessing the neck. When you look at the neck, it's nice and symmetrical. Her trachea is not deviated. I can palpate it, and it's nice and even and symmetrical. I'm going to go ahead and palpate the lymph nodes. Preauricular, postauricular, submandibular, submental, cervical, posterior cervical, supraclavicular, and infraclavicular. Those lymph nodes, they're not tender at all.
No.
Not tender. I don't notice any swelling or abnormalities. They're not warm. They're nice and even and symmetrical for the patient's neck. I also don't notice any jugular vein distension, which is a good sign. I'm going to have the patient take a sip of water and hold it in her mouth so I can palpate her thyroid and her trachea from behind. Can you go ahead and take a sip of water and hold it? Good. Can you swallow? Good. The thyroid was palpable. It was non-tender. You haven't had it. Non-tender, it's soft. I didn't notice any nodules. It did slightly rise when she swallowed, which is appropriate. It's a nice shape and midline as well, with no problems. I will now test or look for her temporomandibular joint. If you'll open your mouth. Good. If you'll move your teeth back and forth. Good. Any pain?
No.
No. No clicks or tenderness felt. It feels intact the way it should. I'll test cranial nerve 11. If you'll shrug your shoulders. Good. You can unshrug them. Now do it again. Good. Cranial nerve 11 is intact. Can you push against my hand? Good. Other side. Up. You can just move your hand up. Good. Down. Good. Her neck range of motion is good and intact the way it should be. I'm now moving on to the posterior thoracic cavity. I'm looking for exertion as the patient is breathing. I'm also looking at her spine while I'm back here. It's nice and even. No scoliosis or kyphosis noted. I'm going to ask the patient to breathe. Good. Her expansion's nice and symmetrical. My hands move up just like they should. I'm also going to percuss the back. Tympany is heard, resonance is heard throughout the lung fields. If there was any hyperresonant sounds, that would be indicative of COPD or emphysema patients. Now I'm going to test for diaphragmatic excursion. If you'll take a deep breath and hold it. Good. You can let it out. And again. Good. I would mark both of those areas, and then I want you to exhale everything out of your lungs and not take a breath. Good. And take a breath, and then do that again. Good. You can breathe normal now. That diaphragmatic excursion is between 3 and 5 centimeters. It's about 4 centimeters, which is normal. 3 and 5 centimeters is normal. I'm also going to be testing for tactile fremitus. Can you say 99?
99.
Again?
99.
Again?
99.
And one more time.
99.
Good. There is some tactile fremitus found. It's equal throughout the vibrations, or what they should be. I'm now going to listen to the back and auscultate the lung fields. If you'll just take a deep breath. Good. Again. Good. Okay, can you lift up your arms and take a deep breath? One more time. Good. The lung sounds heard were clear throughout bilaterally. There were no crackles, wheezing, abnormal lung sounds. There was no diminished lung sounds in her bases. There was good air movement throughout her lungs. I will now begin on the anterior chest. I'm going to listen for her, assess her lungs and her heart as well. I'm just going to inspect the chest. It's nice and symmetrical. I'm going to watch her breathing and make sure it's nice and even, which it is. I would fully expose the patient's chest in a real exam, but for this exam, I'm not going to expose her fully. First, I'm going to palpate and make sure I don't feel any crepitus. There's none. I don't feel any tenderness. No tenderness, no heaves or pulsations noted. Okay, I'm going to palpate underneath your arms, the lymph nodes. Any tenderness there?
No.
Okay, there's no swelling or tenderness noted there. I'm also going to palpate the apical pulse, which is felt mid-clavicular underneath the left breast, and that's also the maximum point of impulse. Now I'm going to listen, aortic, pulmonic, second pulmonic, tricuspid, and mitral. All heart sounds were good. Rate and rhythm is perfectly fine. S1 and S2 were heard audibly. S3 and S4 were not heard. There were no murmurs heard or clicks or any abnormal heart sounds heard on auscultation. I'm also going to auscultate her lung fields. I'm going to percuss her lung fields and then auscultate. Good. Resonance was heard throughout. If any dullness is heard, you are too low over the solid organs or the lung fields are diminished. Take a deep breath. Good. Good. The lung sounds were clear, again, just like in the back. There were no diminished lung sounds, no crackles, no wheezes, nothing of that nature. I'm going to palpate the arteries, the carotid, one at a time, so you don't impede filling to the brain. Good. Good. Brachial. Good. Radial. Good. Abdominal. femoral. Good. Popliteal. Dorsalis pedis. Good. These are all 2+. They're strong. They're not bounding or weaker on one side than the other. Her skin is nice and pink. Her cap refill is less than 2 seconds. On each extremity bilaterally. Her skin is nice and warm. I don't note any edema, pitting edema, any abnormalities there, any swelling. And now moving on to the abdominal assessment. First, you just want to look at the abdomen and make sure it's nice and symmetrical. The contour is flat. I don't notice any distension. The color is nice and pink. Just like the rest of her skin. I will first auscultate all quadrants. All 4 quadrants have normal, active vowel sounds throughout, not hyper or hypoactive. They're nice and normal. I'm now going to percuss over. Tympany is heard throughout her abdomen. As you move up to the liver borders and the spleen, that's where it will be more dull. I'll now percuss the liver borders. Take a deep breath. Good. The liver borders are approximately 8 centimeters, which is normal. Between 6 and 12 centimeters is normal for that. I'll now try to percuss the spleen. Take a deep breath and hold it. Good, you can move it out. The spleen is also dull and is between the 5th, 6th, and 9th intercostal space. I will now try to palpate the liver. I'm going to go on that side. If you'll take a deep breath. Okay, you can let it out. The costal margin of the liver was felt. There were no masses. It was nice and smooth. Any tenderness? No. Good. No tenderness noted. I'll now try to palpate the spleen. If you'll take a deep breath. Okay, you can let it out. And I'll try to palpate the kidneys. Deep breath. Good. One more time. Good. The spleen or the kidneys were not palpable. When palpating the abdomen, I'm going to palpate lightly first. Please tell me if you have any tenderness, okay? Next, you can do deep palpation. Any tenderness? Okay. Patient has no abdominal tenderness, no rebound tenderness, no masses, hernias, anything abnormal felt in her abdomen. For this exam, we are not going to be examining the breast or genitalia, but if we were going to examine the breast, you would inspect them for symmetry, look at the color, the areola, any hair distribution, make sure they're nice and symmetrical, look at the nipples and make sure they're not inverted or anything abnormal, any lesions or discharge there that's not normal. You would also palpate each breast. You could do a chest wall sweep down and hold under each breast and palpate the tops of each to make sure there's no lumps or abnormal masses found. You also need to explain to the patient that she should be doing a monthly breast examination as well as a yearly mammogram and vaginal examination and pap smear. The patient should already be doing these routinely for preventative treatment. Moving down to the genitalia of the female, you want to make sure for the external that you're looking for hair distribution all throughout and making sure the coloration is what it should be. Also that the labia majora is covering the labia minora prominently, that there's no abnormal lesions, discharge, any kind of foul odor in that area, that the clitoris is intact, and you can see the urethral opening and the vaginal opening as well as the anal opening. You'll do the vaginal internal exam first before the anal exam so you don't insert any bacteria into the vagina. Inside, you want to make sure you can palpate the cervix and make sure there's no abnormal masses or abnormal discharge that could indicate infection or any kind of lesions that would indicate STI or infection. On the anus, you can also notice hair distribution, the color, and make sure the anal sphincter is intact. If you do an internal anal exam, you want to feel for any hemorrhoids or polyps, anything or any abnormal masses, as well as any hemorrhoids on the external part as well. I'll move on to the musculoskeletal exam. We're going to be looking at the upper extremities and the lower extremities bilaterally. She has good muscle tone. Her skin is nice and tight. Her joints feel intact. No problems there. We'll look at both sides. She does have about a 2-inch scar to her left wrist from a previous surgery that has been well healed. Her fingers are nice and straight and no problems there, no deformities. Her knees are also intact, no surgical lines here. They're also straight. The bones look nice and symmetrical. They don't look deformed in any way at all. We're also going to test for some strength if you'll squeeze my hands. Good. Can you make a fist? Good. Can you rotate your hands? Good. Can you bend your knee back and forth? Good. And rotate your ankles. Okay. Can you push down on my hand? Good. Can you pull up? Give a pull up. Good. Push down and pull up. Good. That is all intact the way it should be. No problems. Her muscle strength is good. We'll now move on to the neurological assessment. I'll be assessing the patient's sensation. Alright, you'll close your eyes, and if you will tell me if this is sharp or dull.
Sharp. Dull. Sharp. Dull. Did you get it in dull? Sharp. Dull.
Good. Okay. That sensation is intact the way it should be. I'll also be testing cranial nerve 5. Close your eyes. Tell me where and if you feel this.
Forehead. Cheek. Jawbone.
Good. Cranial nerve 5 is intact as well. We will now move on to do some point discrimination tests. If you will close your eyes and give me your palm. Tell me if you feel one sensation or two.
2.
And
1.
good. Point discrimination test is positive if you'll close your eyes and if you'll tell me what this object is.
Quarter.
Good. And if you'll also keep your eyes closed and tell me what I'm drawing in your palm.
Figure 8.
Good. These point discrimination tests, stereognosis and graphesthesia, are positive. Now I'm going to test for upper and lower fine motor and coordination. If you will touch your nose with the end of your pointer finger. Good. Good. Now I'm going to have her alternate her fingers on the thumb. Just fast like that. Good. And if you can also move from my finger to your nose with your index finger. Yep. Back and forth. Good. So this is upper fine motor and coordination, which is intact. We'll now do lower fine motor and coordination. If you can run your heel down the middle of your shin from the opposite leg. Good. And then the other one. Good. Now if you can cross your legs back and forth alternately. Good. Good. So her lower fine motor skills and coordination are intact as well. If you close your eyes, I'm going to test for position sense, upper and lower extremities. If you'll tell me which way I'm moving your finger, up or down.
Up, down, up, down.
Again.
Up, down, up, down.
Good. So these sensations are intact as well. I'll be testing the patient's deep tendon reflexes using a reflex hammer. You'll just relax your arm for me. Good. Let's move your watch. Good. Sure. Good. Good. Just do your good. 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 All of the deep tendon reflexes are intact. I'm now going to test her plantar reflex. Good. Good. If there was a positive Babinski reflex, this would indicate a neuro problem. This is only positive in infants. So now we're going to walk across. I'm going to have you walk just straight, heel to toe. Good. And back. Good. Can you stand on one foot? Good. And the other? Good. Can you close your eyes and stand there? Good. You can sit down. The patient can have an appropriate gait as she walks. Her proprioception is intact. There's no swaying with her gait when her eyes are closed or open. I'm going to do one more test. We're going to test the vibratory sensation on each of your joints. Just tell me if you feel this.
Yes. Yes.
Good.
Yes. Yes.
Good.
Yes. Yes. No. Yes. Yes.
Okay. Good. The vibratory sensation is also present and intact. You will stand up for me. I'm going to test your range of motion. If you can bend and touch your toes. Good. Now if you can turn at your waist, back and forth. Move your shoulders back and forth. If you can raise your arms down, make a fist. Pull back. Good. Push. Good. And you can lift both your legs up. Good. And you can move your ankles. Good. Okay. That is all intact with no issues. Her musculoskeletal and hip stability is what it should be. This concludes our head-to-toe assessment exam for Advanced Health Assessment at University of Texas at El Paso. Thank you for your time and attention.